The PRP scam for patients with poor ovarian reserve. Some of the most difficult patients we see in IVF practice today are those with poor ovarian reserve, what's called UPOS or diminished ovarian reserve or poor ovarian responder. These are typically older women where, in spite of a lot of superovulation, they grow only 2 or 3 follicles. Now, the problem is that this is something which there's very little we can do about because a woman is born with a certain number of eggs, and as she gets older, her ovarian reserve is going to completely decline until she becomes menopausal, and this is an irreversible decline. There's nothing we can do it. There is a biological clock, and the ovaries are really the biggest problem as far as fertility for the older woman goes. But doctors don't share this truth with patients because patients don't want to hear the truth. So what do doctors tell these patients? Oh, you had poor ovarian reserve. We're going to treat you. I use the word treat very deliberately because it's really not treatment. It's ill treatment by injecting stem cells inside your ovary. Stem cells are magic, aren't they? They can become anything you want. These are totipotent cells. These are cells which can transform themselves magically into anything you want. So they will inject these stem cells inside the ovary and say, hey, we're going to give you young, brand new ovaries, which will create lots of great new eggs. That's rubbish. You cannot reverse the biological clock for the ovary. You cannot turn time back. But these patients will be easy to take for a ride because they're so vulnerable and ignorant and gullible. And doctors honestly just want to make money rather than tell patients the truth. But they don't call this ovarian stem cell therapy because the Indian Council of Medical Research has banned this and say that's not allowed. So what do? They call it ovarian PRP. What does PRP mean? It means platelet-enriched plasma. And how do they sell this concept to patient? By saying we'll draw your blood, we'll spill it down. So it's got lots of platelets, and platelets produce lots of great factors like growth factors and stem cells. And then we will put this back in your uterus. And it's your own blood, so there's no downside. I don't know about whether there's no downside. It'll definitely damage your bank balance because they charge an arm and a leg, and it will not increase your chance of getting pregnant. So please do not allow your doctor to use you as a guinea pig and try out all these useless treatments which don't work, which just create false hope, but do not increase pregnancy rates at all.